So maybe I'll start with a question. How many of you believe in witchcraft, spiritual healing? Okay? Okay. So, you know, if you have ever been to a traditional healer, you'll be told that these things started way back, okay? And usually for many of these somatic symptoms and related disorders, you see them later in life, but we know that they started from a young age, okay? And that will be mainly the gist of the talk. So, many times we talk of somatic symptoms, but we should know that they are not just mental events, okay? But there's a lot of psychology, biology, and sociology going on, okay? So when Dr. Dokonyoro says that it can happen in the poor, there are certain factors there, poverty, infections. It can happen in the rich, okay? So it's a mix of many things. You can't just say that it's only the biological process, okay? However, DSM-5, the reason why one of the key features of DSM-5, which Dr. Kimana alluded to, was it deals a lot with a lot of biology, okay? So there's this effort to try and find psychopathology or biology of many of these illnesses. However, I think this is the key diagram. If you're in fourth year, you should never forget this. The interaction, many of these somatic symptom disorders, when you come to managing them, you will deal with a lot of issues. A few weeks ago, I think there was a child in 6B. I don't know if you saw the child on NTV, who couldn't walk and all these issues. But for those who have gone and done around, you'll notice that there are many things playing a part. Okay. However, I was asked to talk mainly about in the brain. So I put this slide to show that things are changing from DSM-4 going to DSM-5. But as Dr. Ekeman had already alluded to it, it's just that the understanding we have of the way things work is a bit different, okay, from a few years ago. So we no longer want to group things together. But in psychiatry, many of the disorders have a comorbid, okay? So you will find a lot of depression, you will find a lot of anxiety disorders, you will find a lot of panic disorders in somatic symptom disorders. So some of the main biological theories are these ones. There's a lot to do with immunology, the endocrine system, neurotransmitters, and putting everything together. Okay? Psychoneuroimmunology deals with the central nervous system and the immune system. We know now they are almost, however much, even if in embryology they develop differently, they are quite similar. Okay? So even with the blood-brain barrier, we know, we keep teaching that blood-brain barrier is impervious to anything, okay? But if you think of almost all neurological diseases and many psychiatric diseases, you don't need to have pathogens crossing the blood-brain barrier to have what? Pathology. So it's very important to know that immune cells, okay, or immune function can get to the brain even when you have a very good functioning blood-brain barrier. Then there are also areas we know in the brain that don't have the blood-brain barrier, okay? Things like the pineal gland and ETC and afferent nerves. And so some of these immune cells, so in one of the cases they talked of a girl being left in the village with the grandmother at the age of, was it 4 or 2? 4 months, okay? So there you think of infections, diet, and things like that. That would cause changes early in life, okay? And then later you start seeing what? Symptoms. So when you're taking a history and trying to get a clear picture of this illness, that is something that will be important, okay? So you won't say that, no, and if something like a child having an infection when they were young, may it be what? Important history, okay, to take. So specifically for symptoms, okay, there's a link between immune function and pain, okay. Many of the patients who will come with somatic symptom disorders will say, we'll have pain complaints. And in the DSM-4, there was actually a pain disorder, okay? So this immune dysfunction or dysregulation starts early, okay? And we know, especially some cytokines like 6 are really associated with what? With pain disorders. And that's the reason why you have a lot of pain in somatic symptom disorders, okay? Then also the subjective feeling of feeling ill, okay? Many times you say that I'm feeling sick, and you want to look for pathology, okay? So you go, you do a UTI, you do sputum, okay? And you find that everything is what? Is normal. We're having a discussion here with Dr. Akiman about someone who came with psychogenic fever. The whole screen is what? Is clear, but you have fever. It doesn't mean that there's no biological process going on. Again, we have said that you don't have to have cytokines actually entering the brain, okay, for you to run a fever. I think that's something that's very important, okay? So sickness, behavior, feeling low, you know, feeling all this somatization that we talk about has a lot to do with the immune function of the body. This diagram just stresses my point that you can have pathogens earlier, okay? Then you have peripheral cytokines which somehow activate brain cytokines and microglia, and then you get non-specific symptoms. So in relation to somatic symptom disorders, and you see that's another thing that changed. In the old days, you would come, okay? You look for all diseases. Once you don't find, that's when you call the psychiatrist, okay? But now in DSM-5, they are trying to change that. You can actually have an illness, okay? But then it goes on beyond what it would normally present with. So many times you find, in the video, the people who had seizures, pseudo seizures. I think I've referred a patient to Dr. Bo with both seizures that are controlled. Then after some time, they are pseudo seizures, okay? And then you start asking, are the drugs not working and things like that. But you don't have to. I think the take-home message is that you don't have to have an actual organism in the body, okay? So you look at the endocrine system. We know a lot. I was given only 5 minutes. We know a lot about cortisol and how it's a stress hormone, and how you will have all sorts of symptoms because of what? Being under what? A lot of stress. Again, okay? It's second sem, fourth year. First time on a rotation, Dr. Mwesiga wants his write-ups, and you don't have enough, and then you start what? You start having seizures, okay? or you start having headaches. And maybe now it's important to say that there are services for students. This is by the way, okay? Medical school is very stressful. Ensure that you talk to any of these clinicians here, because stress on its own can give you what? Symptoms, okay? And then you start doing CBC. If you go to a quack, they will do typhoid, brucella, and malaria, okay? And they will find them all what? Positive, okay? One thing we know is that amino acids, many of them, especially the branched ones, are associated with what? With energy metabolism. So you wake up in the morning, okay, and there's fatigue. There's what they call chronic fatigue syndrome. Just every morning you're tired, because you're in fourth year, and you haven't learned the full diagnostic criteria for depression properly, you think you're depressed, okay? But fatigue on its own can be a symptom, okay? And it's a symptom, it's a psychosomatic symptom, so it's very important to know. EEG studies, I think in conclusion, I'll say this. Sister is in pain, and if you see a lion, okay, and you start running, and a thorn pricks you, you won't stop, not so? You will just continue running because the lion is what? Is a bigger danger. True? Now, every day the brain works to filter what you feel, okay, and what you perceive. So in somatic symptom disorders, what can be a normal symptom is perceived to be what? Something totally different, okay? Because of that lack of filtering, okay? It's somehow similar to anxiety disorders, but you find that we're talking of palpitations. The heart should beat, okay? But in somatic symptom, and when you talk of illness, anxiety, okay? The brain just doesn't filter it as normal, okay? So because of all these immune processes that are going on, the stress hormones, the amino acids, the main pathology is that there's no block, okay? So you're getting all these symptoms and they look bigger than usual. Again, my key point is that it is a biopsychosocial model, okay? So whether it is amino acids, whether it is someone talked about rape and sexual assault, whether it is no pocket money, okay? You can get physical symptoms, okay? But really what's at the core of all of it is that the brain is not just filtering what? Some of these core symptoms, these core signs. So many times you have children, they will come in, they can't talk, okay? They can't walk, and the truth of the matter is that the brain is actually, what's the word? It's responding to them more than it should, okay? And that's a key point. I hope I haven't confused you a lot. I think this is my last slide. So we talk about attachment and attachment theories. As I've said that we shouldn't think of somatic symptom disorders as just in the context of when they appear. So when you're taking a history, you have to dig deep, okay? These are patients who you will see for an hour and you won't have a diagnosis. But you shouldn't feel bad because there are so many things happening and working together. It all ends up in the brain, okay? And many of the symptoms are related to a lot of things that happen in the brain. But if I would give you a take-home message is that there's a lot more, okay? Than just, so it's not, you know, as doctors, the science makes us look clever, okay? But the dealing with the issues is the one that puts bread on what? On your table. So even if you come and you find that they're having pseudo-seizures and you're very excited and you want to write a paper in the Lancet, okay? That may not be as important as sitting down and saying that this is a child who comes from a broken home, okay? The father beats the mother, then beats the child, and that's why it has all these symptoms. Thank you.